everyone, I am Shikaina Aquino Maranga and today I am going to perform perineal flushing return demonstration. Perineal flushing is a hygienic care that involves cleaning the perineum and the genitalia. Washing these areas properly is very important to prevent infection, odors, and irritation. Perineal flushing is mostly needed for those who are bedridden, those who are dealing with incontinence, and also for those who has an indwelling catheter. Prior to the conduct of the procedure, I have prepared the necessary equipments that I need, and this includes a bedpan, a kidney basin, my sterile forceps, 7 pieces dry cotton balls, 7 pieces of cotton balls soaked in a cleansing solution, an antiseptic spray, and a pitcher with warm water. Now, before I begin, I also have performed hand washing. This is done to deter the spread of microorganisms that causes disease and contamination. Good morning, ma'am. I am Shikaina Maranga, your student nurse for today. And may I see your wristband, ma'am? Please state your complete name. Okay, and your birthday, please. Alright, so ma'am, today we are doing the perineal flushing. So basically, what I'm going to do is to just wash your perineal area with warm water and cleansing solution so that you will feel more comfortable and refreshed. Will that be alright? Okay, great. So, will it be fine if I close the door so no one from outside will be able to disturb you while we're doing this procedure? Okay, now position the patient in dorsal recumbent. This is done to provide good visualization of the area to be cleansed and also expose only the area to be cleansed to avoid getting the patient embarrassed and from having chills. Okay, ma'am, so now I am going to expose your perineal area, okay, because we are about to begin. Okay, so I have placed a pad underneath the patient so that we can protect the bed linen from getting soiled. Okay, and then expose this. Okay, now I am going to place a bedpan underneath my patient. Okay, ma'am, so I am going to place a bedpan underneath your buttocks. Can you please lift it up for a second? Okay, and there. Okay, great. After doing that, I am going to flush the perineal area with warm water. Okay, so as we are doing this, we are also inspecting the perineum. Note for any or particular areas of inflammation, swelling, excessive discharge, secretions from the orifice, and presence of odors. Okay. Now, warm water is used to avoid the patient from having chills, and also this softens or dissolves blood clots. After doing that, I am going to place this kidney basin here. This is where I am going to discard the cotton balls that I am going to use. Okay, now using my pickup forceps, I am going to pick up 1 cotton ball soaked in a cleansing solution and start cleaning the external genitalia of my patient, starting at the midline, at the symphysis pubis, down to the anus. Okay. Alright, and then discard. Now I am going to pick up another cotton ball and start cleaning the labia majora that is on the far side from me. Okay, starting from the mons pubis in figure 7, by way of labia majora down to the anus and then discard. We should never retrace a stroke to avoid contaminating the cleansed area. Now I am going to do the same with the labia majora that is near me or near my side. Okay, and discard. Now I am going to pick up another cotton ball and start cleaning from the mons pubis, figure 7 to the labia minora down to the anus and discard. Do likewise on the opposite side. Okay, figure 7, labia minora, discard. And then another cotton ball used for cleaning the groin area of the patient. Discard, and then here, discard. Okay, so we're done with that part. Now I am going to flush the perineal area with warm water again. Okay, ma'am, so now I am going to flush your perineal area with warm water. Okay. After doing that, I am going to dry my patient's external genitalia using dry cotton balls. I am going to do the same stroke as what I have did with cleaning the genitalia using the soap cotton balls. So I am going to start at the midline, symphysis pubis, down to the anus, discard. I am using a different forceps for this portion. I now, from the mons pubis, figure 7, labia majora down, discard. Now do the same on the opposite side, discard. Okay, labia minora, discard. Labia minora, opposite side, discard. I'm going to clean the groin area. Okay, discard. The other groin area, discard, and we're done. Okay, ma'am, so we're done cleaning your genitalia. I am now going to take the bedpan off beneath you. So can you please lift your buttocks for a second? Okay. Okay. And then after doing that, I need you to turn a little to your side so that I can also dry off your buttocks area, okay? So please turn a little. Okay. If necessary, clean the buttocks of the patient using another cotton balls. Okay. Okay. Now you can lay down on your back again, ma'am. Okay. So now I am going to use an antiseptic spray. This promotes healing. Okay, so after doing that, I am going to place a perineal pad on the patient. Okay, ma'am, so we're done. I am going to let you wear an underwear with a pad in it, okay? Alright, so here it is. Okay, I'm going to take off this pad. how are you feeling now, ma'am? I see. Okay, great. Right. Okay, great. So that's it for today. And we're good. I'm going to leave you now so that you can have some rest, okay? Okay, so after doing the procedure, perform aftercare of the equipments used. A clean environment promotes comfortability for the patient. Also, after doing the procedure, perform hand washing to prevent infection and contamination. Also, document the procedure done. For the documentation of the perineal flushing, record treatment done to the patient, any unusual findings such as redness, excoriations, skin breakdown, discharge or drainage, and any localized areas of tenderness.